Well, cold weather is settling in over the state, and that means a return of cold and flu season. This year has seen a higher than normal cases of respiratory syncytial virus, or RSV, in children across Indiana and the nation. According to an Indiana Hospital Association news release, at the beginning of November, 70% of pediatric beds in the state's 5 biggest children's hospitals were occupied. The surge in RSV cases typically peak in the late fall and winter. We're joined now by Jennifer Coddington, a clinical professor in the Purdue University School of Nursing, for more about RSV and what parents should watch for in their children. Professor, welcome so much to the show.
Thank you for having me.
So the number of children treated for RSV this year has been higher than last. Why do you think that is?
RSV definitely has come earlier this year for us, and it's hit us much harder than it has in years past. Typically, RSV peaks in the winter season, so we're usually looking at like January, February for it to peak. But it's really not known, I think, why it has surged or come earlier this year. The thought is that the virus is encountering a hugely vulnerable population right now of infants and children who are not protected against those common pathogens because they have not been exposed to them during the pandemic and the lockdown, and their immune systems are just not working against these common pathogens right now.
So how severe can it be? What should parents be on the lookout for?
Yeah, so RSV can be severe in certain populations. So those populations, those high-risk populations, would include premature infants, babies with congenital heart disease or with chronic lung disease, and then also some older adults as well. So parents really should be looking for if their child is sick, if that cough is getting worse, if they're wheezing and that's getting worse, if they have what we call retractions. So that's where those muscles in between the rib cage are really pulling. If all of those things are occurring, or they're getting blue around the mouth or blue around the lips, then they really should seek emergency care if any of those symptoms occur.
Now, how about the best defense against the virus?
Yeah, so best defense, as we all know, is prevention. So prevention includes that hand washing under soap and water and doing it very often, cleaning surfaces that we use often, cleaning those often. Avoiding that close contact with those high-risk populations. So those little babies that we love, they're very cute, we want to kiss, really trying just not to do that. There's also a drug that we use called Synagis that helps prevent severe disease. But this can only be used in certain populations that I just talked about, those high-risk populations in infants and children under 2 that are premature babies, have chronic lung disease, have congenital heart disease. If they meet that certain criteria, we can also give them that medication to help prevent that severe disease.
Is there any concern about cases trending back up with the holidays coming up, more people gathering indoors?
Yeah, of course. I think we're going to all be around our friends. We're going to all be around groups of people, family. So, as I mentioned, it's going to be really important to do those prevention techniques of hand washing and cleaning surfaces. And, if you're sick, staying home, making sure that you're masking up, and of course, avoiding those close contacts if you are feeling sick.
All right, Professor, thank you very much for being on the show. Appreciate your time.
Yeah, thank you for having me.